This is what this is dedicated to, the new bureaucracy of the market. The Secretary of State has all the power but no responsibility. And now we have a series of regulators, economic regulator, a quality regulator, monitor, and the Care Quality Commission, and a plethora of new bodies. But the most interesting group are these clinical commissioning groups here in the blue. They are receiving £80 billion worth of funds every year, and they're modelled along insurance fund lines. So this is a new bureaucracy, and this is why nobody can understand who's in charge or what's happening today. So clinical commissioning groups are insurance-based, they're not area-based. Not everybody in an area is automatically covered anymore. People are recruited on the basis of belonging to a general practice, but people can become excluded or ineligible either because of their conditions of treatment or because of their own status. And the same has happened. This volume here has given huge new powers to these NHS providers. Services now are being broken up across the country. They're being put out to tender to commercial companies. There's not a day goes by when you hear of huge contracts. NHS hospitals are being starved of funds, they've been going into financial deficit, the administrators are coming in, they're either being sold off, franchised, or closed down. Complete loss of planning on the basis of need because nobody in your area has responsibility anymore. The NHS has been reduced to a logo, a funding stream, £112 billion. And instead, we have a myriad of new companies. Here they are. Circle, which is franchising for hospitals, Netcare, many of them American, South African, Canadian companies from all around the world. So £112 billion of NHS funds are flowing to hundreds of commercial providers, shareholders and banks every day of the week, £112 billion. So why is the government doing this? Well, it said it was all about patient choice, dignity, respect. But of course, it's not about patient choice. It's about giving providers choice of patients. The other thing is the government said markets are much more efficient. But of course they're not. There's not a country in the world that delivers universal healthcare through a market. Not one country. And if anything, all the evidence shows that when you bring in a market, it becomes much more expensive. But the second thing that we should remember is the American healthcare system. America is what it's modelled on. 18% of GDP, the outlier at the very end. Twice what Britain's GDP is. And yet, in America, 61 million people, 1 in 5 people go without healthcare. They have no health insurance or coverage. 2/3 of all medical bankruptcies are due to healthcare bills. And millions of people spend 10% on healthcare costs. And it brings enormous new inefficiencies, a market that's not there in a publicly owned system. The first is insurers, marketing, billing, pricing, profit, insurer billing, physician billing, and hospital billing. Take a bigger and bigger, and then the administration costs. So that only 60%, 60 to 64% is left for medical care, to employ the staff, to buy the drugs, to buy the medicines. In the NHS, it was the most efficient system in the world. It was only 6% of the total budget went on administration costs, compared with what happens in the US, where it's between 30 to 40%. But markets also bring new pressures, because one of the things is that the job of a commercial provider is to find a treatment that you don't necessarily need, but that somebody will pay for. And the Institute of Medicine in the US has come out at nearly $3 trillion spending in the US, where more than $1 billion, $1.5 billion is completely wasted. Sorry, $1 trillion is completely wasted. The noughts are too many to comprehend. Unnecessary services. The companies that now in the UK, like Hospital Corporation of America, are being done for fraud and embezzlement and treating patients for heart surgery that they didn't actually need. Inefficiently delivered services, excess administration costs, prices that are too high, misprevention opportunities. From the most distinguished Institute of Medicine report, over $1 trillion. Extraordinary. That's what lies ahead for us, because it's the American companies and the American health insurers that have been putting pressure to remodel the NHS along US lines.
I'm delighted to be able to congratulate you on what was a stunning election victory. And as you say, the invitation is an indication of the strength and importance of the special relationship that exists between our two countries, a relationship based on the bonds of history, of family, kinship and common interests.
Mr. Speaker, last week I also asked the Prime Minister to assure the House that in any United States trade deal she would not offer up our National Health Service as a bargaining chip. She gave no answer. When asked in the US, she also refused to rule it out. So let's ask her a third time. Will she rule out opening up our National Health Service to private US healthcare companies? Yes or no?
Mr. Speaker, I could give a detailed answer to the right honourable gentleman's question, but I think a simple and straightforward reply is what is required. The NHS is not for sale and it never will be.